Hi, my name is Vivian Kadais, and today I'm doing my community health teaching project on STDs and contraceptives. My audience is adolescent girls. First, I'm going to start by talking about STDs. I'm going to start with chlamydia, which is caused by Chlamydia trachomatis. It affects mostly young women and men. It's said that 1 in 20 young women actually has chlamydia. It is spread through vaginal, oral, and anal sex. Symptoms for chlamydia: a lot of times there's no symptoms at all. If you're a female, you may experience burning upon urination or vaginal discharge changes. Males may experience burning upon urination, discharge from the penis, and pain in the testicles. Treatment for chlamydia is actually a round of antibiotics. It's really important to take a full round of antibiotics for them to be effective, and it is also important to inform all of your partners and not have sex during the time you're on antibiotics. Some long-term effects: if you have chlamydia, you can actually pass it on to your baby if you're pregnant. You can also experience pelvic inflammatory disease, which is when you experience inflammation in your fallopian tubes, uterus, and surrounding tissues, and this can cause an increase in the chances of having an ectopic pregnancy, a stillbirth, or just having issues with your baby. And then I am going to move on to gonorrhea. Gonorrhea is an STD caused by Bacterium necessariae gonorrhea, and it affects the mucous membranes of the cervix, uterus, fallopian tubes, mouth, throat, and eyes. It affects both males and females and is spread mainly through vaginal, anal, and oral sex. A lot of times there may be no symptoms at all. If you're a man, you may have burning during urination and ejaculation, discharge from the penis, and also testicular pain. If you're a female, you may experience burning upon urination, change in discharge, and also experience bleeding in between periods. The treatment for gonorrhea: the CDC recommends dual therapy due to growing antimicrobial resistance. So you're going to have 250 milligrams of ceftriaxone and 1 gram of oral azithromycin. So ceftriaxone is an anti-infective that binds to the cell wall and disrupts the cell wall, causing death. Some side effects include SJS, nausea, vomiting, diarrhea, seizures, and hemolytic issues. Azithromycin is also an anti-infective used to help treat mycobacterium, and it inhibits the protein synthesis. It's a bacteriostatic and can cause hepatotoxicity, ototoxicity, and abdominal pain. Long-term effects of gonorrhea: women can also experience pelvic inflammatory disease if gonorrhea is not treated. So like we talked about, that is going to be inflammation of your uterus, your fallopian tubes, just all of your tissues. And then it could also increase your chances of ectopic pregnancy, stillbirth, or even infertility. Women who have gonorrhea can also pass it to their baby, and their baby might experience joint infection, color blindness, and even some blood infections. Now I'm going to move on to syphilis. So syphilis is an STD caused by Treponema pallidum, and syphilis is very easy to treat, but it can become very serious if not treated. It affects both men and women, and is spread mainly through vaginal and oral sex, and it is spread through a canker sore. So their sores are called canker sores. So symptoms for syphilis: it's known as the Great Pretender because it can be known as a lot of diseases. It's also split into 4 stages. So you have your primary stage, which is when you experience your first canker sore, and they're usually firm, round, and painless, and it will heal within 3 to 6 weeks no matter if you've had treatment or not. The secondary stage, you may experience rash, fever, and skin lesions, and also swelling of lymph nodes and possibly fever. And then latent stage of syphilis is when you have no symptoms at all. And then the tertiary stage of syphilis can appear years later after you've had it and you may not have known or gotten treated. And it can affect other systems of your body, like your nervous system, your lungs, your heart. And so treatment for syphilis is going to be benzathine penicillin. So that's for any stage, but depending on what stage you have is how many times you were going to get the dose and what dose you're actually going to get. So for primary, secondary, and early latent syphilis, you should have benzathine penicillin 2.4 million units IM in a single dose. And for latent syphilis, or unknown, you will have 7.2 million units, 2.4 million units administered weekly. Long-term effects. So obviously, like I said, syphilis is very serious if it's left untreated. Pregnant women can pass syphilis on to their child, which can increase the chances of having low birth weight, increase the chances of having a stillbirth, and if your baby is born, they could have cataracts, deafness, and seizures, possibly death. They may not even experience any symptoms when they're born. Benzathine penicillin is an anti-infective that binds to the cell wall, causing cell death. Some other serious long-term effects of syphilis are neurosyphilis, which is when syphilis spreads to your brain. This can cause paralysis, movement issues, headache, and numbness, possibly dementia, and you can use a blood test to diagnose this. And then there's also ocular syphilis, which is when syphilis is obviously affecting your eyes, so you could have visual changes, decreased visual acuity, and eventually permanent blindness. And so this is a picture of your skin rashes that you would experience maybe during your second stage of syphilis. And then I'm going to talk about trichomoniasis. So trichomoniasis is caused by Trichomonas vaginalis, which is a protozoan parasite, and it's the most common curable STD, and it mostly affects women, although it can affect men. And it is spread mostly through vaginal sex. And so some symptoms for trichomoniasis: a lot of people are asymptomatic. Men may experience itching and burning of the penis, burning during urination or ejaculation, and discharge from the penis, while females may experience itching, burning, redness around the genitals, or during urination, and then change in your vaginal discharge. Treatment is treated with metronidazole. I know I said that wrong. And then this medication is safe for women, and to avoid getting reinfected, make sure that you tell all your partners. Metronidazole is an anti-infective antiprotozoal that disrupts the DNA synthesis, or DNA and protein synthesis. It's also a trichomonicidal. And some side effects are some dizziness, headache, abdominal pain, SJS, and rash. So long-term effects of trichomoniasis include women who are pregnant with trichomoniasis are likely to have babies preterm or with low birth weights. And then it can also increase your chances of getting other STDs or HIVs. This is generally because you're participating in the same behavior that you were when you acquired trichomoniasis, and it can make it easier to get HIV. So then I'm going to flip this around. Okay, so now I'm going to be talking about HPV, which is human papillomavirus, and it is the most commonly transmitted STD in the United States. It affects both men and women, generally from the ages of 14 to 25 is where it's most common, and it can be spread through vaginal, anal, and oral sex. A lot of times there's no symptoms for HPV, but you may experience genital warts, and it can also cause certain cancers. So treatment for HPV, there's no treatment for the virus itself. However, there is a vaccination, which is generally recommended around the age of 11 or 12, and I know you can get the vaccination when you're older, but it just kind of depends on what age and what you need it for. And then long-term effects: if you're pregnant with HPV, you may experience genital warts and abnormal cell changes in your cervix. HPV can also cause cancer, cervical cancer, cancer of the anus, cancer of the vulva, cancer of the penis, and oropharyngeal cancer. So next I'm going to talk about genital herpes. So this is a visual of genital herpes. So genital herpes is caused by herpes simplex virus 1 or 2, and it affects both men and women, and it is transmitted through herpetic lesions, mucous membrane secretions, and oral and genital secretions. And you may show no signs or symptoms at all, but you may have small blisters around the genitals or mouth. Your first outbreak, you may experience fever, body rash, and swollen lymph nodes, and then during recurrent outbreaks you may just have general pain, genital warts, and tingling in the legs. So treatment for genital herpes: there is also no cure for herpes. However, antiretroviral therapy antiviral medications can be used to shorten the outbreak, the outbreak. And then also daily use of suppressive therapies can help prevent spreading from other partners. So long-term effects of genital herpes. Having herpes may make it easier to get HIV, like I kind of touched on before. You have the same general behaviors, so you may acquire other STDs or even HIV. Neonatal herpes is a very serious complication and can often be fatal. And then also they found that antiviral medications are not shown effective during the third trimester, so it's just really important to be going to your prenatal appointments and talking to your doctor and making sure that everything is okay. And then finally, we're going to talk about HIV. So people with STDs are more likely to acquire HIV. HIV is human immunodeficiency virus, and it spreads through body fluids and can attack the immune system, so it makes it harder for you to fight off infections. It is common in both men and women, and is spread mainly through vaginal or oral sex. Symptoms: you may experience fever, swollen lymph nodes, pneumonia, rash, and weight loss. There is no cure for HIV. However, antiretroviral therapy can slow the progression of the disease into AIDS. And then I also found this really cool treatment called PrEP, which is a medication that you take every day to decrease the chances of you spreading HIV to a partner. So if you take it every day, it reduces the risk by 99%. And then long-term effects: obviously HIV can progress to AIDS, and it can cause issues with your immune system, and it makes it easier for you to acquire other STDs. So what the really important takeaway is from STDs is to obviously have safe sex, have open communication, and just be informed. So next I'm going to talk about contraceptives. So there's actually a lot of contraceptive options. I learned about a couple that I didn't even know were options, and so I thought that was really interesting. So we're going to start with barrier methods. So that's female condoms, male condoms, diaphragms, cervical caps, and contraceptive sponges. I've never heard of contraceptive sponge, but I have a picture of one right here, and I think it's just really interesting. And then short-acting hormonal methods. So these are short-acting because you have to remember to take them on a daily, weekly, or monthly basis. So that would be your birth control pills. An example would be Loestrin, vaginal rings like NuvaRing, skin patch like Xulane, contraceptive injection like Depo-Provera, and then long-acting hormonal methods: copper IUD like Paragard, hormonal IUD Mirena or Kyleena, a contraceptive implant like Nexplanon, and these can last up to 3 to 10 years. So here is an example of contraceptive implant Nexplanon, and these are just different versions of IUDs. These are generally the most effective forms of contraception. And then finally, sterilization, tubal ligation or vasectomy. And I forgot to include it on here, but when I was doing further research, Plan B would also be a form of contraceptive. And then, so I'm just going to talk a little bit about ways that the contraceptives work. So it can either prevent the sperm from making it to the egg, it can inactivate or damage the sperm, it can prevent the egg from attaching to the uterine lining, and it can prevent the egg from being released. And like I said, contraceptive implants and IUDs are the most effective. So looking at some research I did to go along with my contraceptives and STDs, I found this really cool journal article about the Health Education and Relationship Training Program, HEART, which was developed to increase sexual awareness and enhance sexual decision making in adolescent girls. And so they did this study with mostly minorities, and I believe they were in 10th grade. And this is an online program that is teaching young girls about STDs and contraceptive methods in order to prevent unplanned pregnancies. So adolescent girls, and particularly minorities, are disproportionately affected by STDs and unplanned pregnancies. 1 in 4 adolescent girls actually has an STD, while 250,000 girls actually give birth each year, adolescent girls. And girls with STDs who are not treated may experience long-term issues like we talked about, like PID or cervical cancer, ectopic pregnancies, and even infertility. So HEART is a really good option because it's an online program, so it's pretty low cost and should be accessible to everybody, especially through schools. And their goals are to work on safer sex motivation, knowledge regarding HIV and other STDs, sexual norms and attitudes, safer sex and self-efficacy, and sexual communication skills. And so they have online modules that go with all of those 5 categories, and the people teaching the modules are actually girls in their own age group, so I think it's probably easier to relate to. And the girls that completed HEART had a statistically significant greater knowledge regarding HIV and other STDs, and they also had greater condom self-efficacy. And so HEART is also really great because it can be completed in less than an hour, and like I said, it's online, and it might actually help schools with their sexual education. And then I also wanted to look at where you can be treated for STDs or find information for STDs and even contraceptives. And so I found a journal article that said that STDs result in a large healthcare expenditure of up to $16 billion annually. And that STD clinics are an important part of healthcare, obviously. They provide STD information, STD testing, treatment, risk reduction, in HIV testing as well. These services are provided at either low cost or no cost. So for minorities or people that don't have health insurance, these are really great options. And people actually find STD clinics more helpful than going to their primary physician because of the experience, the convenience, cost, confidentiality, and being able to walk in or not have an appointment. And then I actually found a really cool study that was done in Ghana at the University of Cape Coast, and it showed that the level of knowledge about STDs was unmatched to the behavioral practices. So even though students knew about safe sex and they knew about contraceptives and STDs, they weren't putting condom use or contraceptives into practice. So I thought that was really interesting. And then they said that sexual education should be introduced into university settings to increase awareness of prevention of STDs. And then some more resources. So these were journal articles that I was looking at. But Planned Parenthood, I think Planned Parenthood kind of has a bad reputation. I think a lot of people just associate Planned Parenthood with abortions, but they offer a lot of information about STDs and contraceptives and being able to get STD tested or even getting forms of contraception. And their website was really cool. They had a lot of videos and it was easy to navigate. And then I also found a website called Get Tested that was created by the CDC. So you put in your zip code or wherever you live, and so then it will tell you places where you can get STD tested and for certain STDs and how much it will cost and that kind of information. And then Pat Walker even has an STD clinic. I think it's called Get Yourself Tested. And so they test for chlamydia and gonorrhea, and you should have your results within 2 to 3 days for results. So I was able to find a lot of really good information about STDs and contraceptives, and I hope I educated you somewhat, and I hope you learned something, and thank you for watching.